doctor José Luis Alomía, director general de epidemiología. Y hoy nos acompaña nuevamente nuestro colega, el doctor Ruy López Ridaura, quien es el director general del Centro Nacional de Programas Preventivos y Control de Enfermedades, CENAPRESE. Ella había estado aquí hablando de COVID. El doctor López Ridaura ha estado al frente de la coordinación de varios de los procesos de expansión hospitalaria, de la planeación de los insumos, de la verificación técnica y las recomendaciones técnicas sobre los distintos insumos, incluyendo los ventiladores y varias actividades relacionadas con el COVID. Pero hoy viene por otra razón y es el dengue. El dengue. Ya empezó a llover, ya empieza la temporada.
Today he's here for another reason, and that's
Ella había estado aquí hablando de COVID. Dr. López Ridaura ha estado al frente.
Dr. López Ridaura has been in front of the several hospitalian processes about the technical recommendations of different resources and activities related to COVID. However, he's coming today for a different reason. It's because it's rain season, and so mosquitoes are starting to appear even more so. So we have epidemiological interest on this. And this is an epidemic that has happened throughout many years now, practically throughout all the national territory. Some other areas like Aguascalientes, for example. So he is going to speak now about what the program has been doing, the program that he's been directing, and how should we get ready about the epidemic of dengue, because these both epidemics are going to coexist. And most of the sick people have very serious symptoms. So this could be a special challenge for us. So thank you, Doctor. If Dr. Alomía can present the technical report, I'll show a couple of slides and then we can move on to Doctor. Thank you. Good night, Mr. Secretary. Good night, everyone. This is our conference 97, fourth day now of the new normal. And let's all remember that the national stoplight is in red for most of the states. This will be current up until Sunday. We'll be showing the stoplight that will be starting on next Monday. So depending on the state and on the risk of everyone, we can either open or close activities, job activities, educational activities. Next slide on the international scene. We're still at 23% in the pandemic. And if we can see the percentages, they're pretty similar to the stabilization to the last days. But less of a fifth, 17% of this great total, which are 18,377 people, are the active people who have showed symptoms in the last 14 days. In the same way, 12,545 are the people who sadly have lost their lives due to complications on COVID-19. Next slide. We can see the spread of cumulative burden. Yesterday, we started with a new scale. We added 4 new colors. So we can see how this burden is moving. This is cumulative burden for each day and all of the cases that keep adding up each day so that we can see and have a better visual
precisamente cada día acumulando más.
on
más
how
carga,
they
y por
are
eso se
getting
activaron estos
accumulated.
nuevos 4 colores. Que cuando los vemos en la
When we see
siguiente
these colors in the
diapositiva,
next
ahí
slide,
podemos
we
ver
can see
rápidamente
pretty
identificar que
fast
estas nuevas categorías están, bueno, los 3
how we
estados
can
que casi desde un
identify
principio de
the
la
three states
epidemia
who
en
have
México fueron
been
las que
mainly the
estuvieron
first three ones
acumulando
that
desde
have
los
been
primeros casos
going
la
on
mayor
throughout the
carga.
whole epidemic with more burden.
82.7 la incidencia por 100,000 habitantes,
82.7 is
que
the
hasta el momento se
incidency
ha
for
presentado en México.
100,000
En la siguiente diapositiva
inhabitants.
volvemos nuevamente al mapa, pero ahora el mapa
Next up, we
solamente
can see
registra
in the
la
map
epidemia activa en México,
the active epidemic in
18.377
Mexico,
casos. Aquí ya vemos que los colores
18,377
son más
confirmed
claros.
active
Hemos
cases. We can
tenido
see
varias
lighter
entidades
colors
federativas
here.
en
We've
colores
had a
rojos,
lot of
pero recordemos que
states
esto no necesariamente
here that are
tiene
in
que
red.
escalar a
That
un color
doesn't
más
mean
oscuro, porque si en una
necessarily
entidad
that it
federativa
has to
empieza a haber
go
control y los
darker.
casos
If a
empiezan a
state
disminuir,
has
como esta es una ventana
a
móvil
certain
de los
control,
últimos
since this
14
is a
días, entonces
mobile
podemos ver realmente
window for
que
these
migren
14
o
days, we
pasen
can
a colores
see
más
what they
claros, pero
are
no necesariamente a colores
measuring,
más
and
oscuros.
either they start
En
going
la
darker or
siguiente
lighter.
diapositiva vemos la distribución en orden
Next
descendente.
slide, we can
Ciudad de
see the
México
proportion
como
in
la entidad
decreasing.
federativa que,
Mexico
que la carga
City
acumulada,
is the
es la que
state
también en
with
los últimos
cumulative
14 días
burden for the
concentra
last
la mayor
14
cantidad
days with
de
most
casos,
cases.
seguida por el Estado de
Next up
México y
is
Tabasco.
Mexico State
Veamos la
and
siguiente
Tabasco.
diapositiva. Esta es la tasa de
Next
incidencia
slide, we can see the
acumulada de estos
cumulative incidency
18.377 casos
of
activos.
these
Igual, este es un mapa
18,377
móvil, no más que es una
cases.
tasa de
This is
incidencia,
also a
y los
mobile
colores más
map,
oscuros pueden
but
estar o
also has to do
incrementándose o
with the
disminuyendo,
incidency. We can see
dependiendo
that the
si en la
darker
entidad
colors
federativa se
have gone
intensifica
lighter,
o empieza a haber control
or that
de
they
la
can
epidemia.
start having more
Lo vemos, de
control
hecho, en
in
la
the
siguiente
epidemic
diapositiva, en donde
for
tenemos
these
precisamente
states.
esa
In the next
comparación
slide, we can see the
con la
comparison
tasa
between
de
the
incidencia
incidency
de hace
rate
2 semanas.
for 2
La que
weeks
está en
ago.
verde es la actual, es decir, es la
Green
última,
one is the
es la de
current
los
one
últimos 14 días,
for the
y las
last
barras
14
azules son
days, and the
la tasa
blue
de
ones
incidencia
are
que
the
había
incidency
hace 2
rate for
semanas,
2
también
weeks
de los
ago,
últimos 14 días,
also
y
for the
entonces aquí
last 14
podemos ver
days.
los diferenciales que se van
We
presentando
can see
en
the
cada uno
differentials for
de los estados.
each state
Así también
here,
vemos la tasa de incidencia
and
total
also the
para México,
incidency for
como
Mexico
medio
as a
azul
total.
se ha ido
That's the
incrementando
blue
porque
one.
se va
How it
acercando
has
a la verde,
increased
es el
because it has been
14.4 de
reaching
este
the green
10.1,
one
y en un momento
at
podremos
a
llegar a ver a lo
10.1
mejor un
incidency.
acercamiento
And we
hacia
can
donde haya
also
una
see
nivelación que será en un momento el
how it's
promedio de
going to
todas las
start
tasas de
balancing
las entidades
towards
federativas.
an average
Pasemos a la
throughout
siguiente
all the
diapositiva.
states.
Tenemos la
Next
distribución
slide, we can
de
see how it
las
spreads,
defunciones que han ocurrido
on
por
how the deaths
fecha en la que
spread
se llevaron a cabo. Vemos en las
per date.
barras que tienen el color
We
naranja
can
claro,
see the
aquellas que todavía son
light
defunciones
orange
sospechosas porque están
bars.
esperando un resultado
We can also
de
see the
laboratorio. El día de hoy
suspected
son 1033,
fatalities because they're
por lo
still
tanto
waiting for
esta
lab
cifra pues se
results.
va a ver incrementada en los
So
siguientes
this
días cuando
number
estas
can
defunciones
increase
se
in the
confirmen.
following days
En la siguiente diapositiva
until
vemos la
confirmed.
distribución de las defunciones por la
You can
entidad
also see
federativa
the
donde
spread
ocurrieron,
of the
e igual
fatalities
en el
per
segmento
state,
naranja
and
claro
also
la
the light
expectativa
orange
de
color
crecimiento
is
de cantidad de defunciones que puede
how
ocurrir
we are
en los siguientes días.
expecting them to
Veamos la
increase
siguiente
or decrease
diapositiva, que es
throughout the
la
following
curva
days.
epidémica.
We can now
Vemos cómo los
see
casos
the epi
sospechosos
curve,
pendientes
the
de un
suspected
resultado se están
cases that are
concentrando en
waiting
los últimos
for
días. Ha habido un
results, and they
incremento
have been
de
concentrated
estos,
in the last
recordando que
few
este también
days,
es
and
un
there has
número
also been
móvil,
an
porque
increase
el número
in
de
those
casos
numbers.
sospechosos todos los días
This is a
se
mobile number as
modifica
well
en
because
función de
suspect
los que
cases each
pasan a
day
ser descartados porque
can
salió su prueba
change,
negativa, pasan a ser
however they
confirmados
are
porque salió su prueba
tested or
positiva,
proven
o se
positive or
incrementan
negative.
porque se suman los casos sospechosos que demandaron atención médica en las
And they
últimas
can
24
also
horas. Esto
increase
se ha visto
because the
incrementado
suspect
porque
cases
entonces
will be added
el
up to
ingreso de
them.
casos sospechosos en
So in
los
this
últimos
case,
días ha sido
the
mayor, y
suspect
eso lo
cases
podemos ver
has been
también
larger in the
en la
last few
tendencia
days, so that's
cuando vemos
how
las dos barras.
why it
Si
has
vemos la
increased.
siguiente diapositiva, tenemos la
If we
carga
see the next slide, we can
acumulada
see
de casos
the
confirmados.
cumulative burden for confirmed
4.442
cases
son los casos confirmados en las
for
últimas 24 horas, pero no
4,442 in
son
the last
casos que
24
ocurrieron en las
hours.
últimas
These are
24
not
horas. Estos
cases that
están
happened in the
distribuidos por
last
su fecha de
24
inicio de
hours.
síntomas
These are
prácticamente en los últimos
distributed
15 días.
per the date where the
4.4%
symptoms
fue este
started,
incremento
and it
para
can
llegar a esa carga
take up to
acumulada
14
de los
days previous to today.
5.680. Veamos ahora rápidamente la
Now,
ocupación
next up, we'll see
hospitalaria.
the
El día de hoy sube
hospital
un puntito
occupancy.
porcentual más, 45%.
We have
Es una buena tasa de
0.1% more
notificación.
of
El
an increase
96% de
today.
las unidades notificaron sus
96%
camas
of
disponibles o sus
units
camas
have notified their
ocupadas, y
available
pues bueno,
beds or
45%
occupied
nos dice
beds.
que de 22.562
And
camas IRAG
for
general que se tenían, 10.131 están al corte del día de ayer a la
22,562
medianoche
total IRAG
ocupadas.
beds,
Pero la siguiente
up until the
diapositiva
cutoff to
podemos ver cómo se
yesterday,
distribuye esta ocupación en función de la entidad
10,131 were occupied.
federativa.
And here we
Vemos a
can see how
percatarnos de un
those spread
incremento
per
en la
state.
Ciudad de México, que
We can
llegó a
also notice an
82.
increase
Estado de México ha
in
mantenido también esta ocupación alrededor del
Mexico City and Estado de Mexico.
Serían las entidades que tienen la mayor
These are
ocupación,
the
pero
states that
vemos
have
también
more
otras entidades que en
occupancy,
este
but we
momento
can
no están
also see
teniendo
other states
una
that do
demanda y
not
una
have
carga importante de
that
esto, como
much
Zacatecas,
demand
San Luis Potosí y
or that
Aguascalientes. Si vemos en la siguiente diapositiva,
are the case,
esta
such
es
as
la
Zacatecas and
disponibilidad de ocupación
Aguascalientes.
de camas críticas.
Next
Un
slide
poquito
is
porcentual
the
más también en
critical
relación
bed
al día de ayer,
for
38% es
critical
el día de hoy,
cases, the
y
occupancy
son
and availability
3
for
entidades
critical
federativas
cases.
las que
There are
tienen
3 states which
prácticamente el
have
primer lugar de ocupación juntas: Baja
first
California,
place
Ciudad de
for
México, Estado de
occupancy,
México, que han
which
sido
is
además
Baja
las entidades que en las
California,
últimas 2-3
Mexico
semanas
City, and
han
Mexico State.
mantenido esta
In the
ocupación,
last
pero
3 weeks,
todavía
they've
hay la
kept
posibilidad
their
de recibir
occupancy,
pacientes y de poder
but they have
dar este tipo de
still
atención,
also
porque
have
todavía hay una
the
disponibilidad
availability
de
to
34%,
see more
al menos en
patients,
estas entidades. La siguiente diapositiva
34% for these 3
es en
states.
relación a las
Next
unidades.
slide
El
has
día de
to
hoy
do
también
with
hay
the
incremento de una
units.
unidad más,
We
792
also have an
son las
increase
unidades COVID que están que pueden
in
notificar
COVID
a la
units.
red, y pues
These
vemos
are the
cómo en
units
función de
that
la
can
necesidad, a medida que la epidemia ha
make
continuado
their notice
creciendo,
to
se
the
han
network,
habilitado
and we
más
can see
unidades
how
hospitalarias para poder dar la
these
atención
hospital
a
units
las personas
have
que así lo
been
requieren. Sería la actualización para
fitted
esta noche.
to receive more patients
Muchas,
with the
muchas
conditions
gracias,
that
doctora
they
Lumía.
need to have.
Yo
Thank you, Dr.
quisiera, como
Alumia.
ayer, presentar
So I would like yesterday to
nuevamente
present
la información
again
completa de esta adición de
the
las
complete
840
information
y tantas defunciones, 816
for
defunciones
these
que hoy se
816
presentan. Es
fatalities
parte del
that
mismo proceso,
were
ya no me
presented
detendré a
today.
tanto
This is
detalle,
part of the same
pero
process.
es
I
el
won't have
resumen
as much
de lo que
detail,
estamos haciendo
but this is a
para
summary of
estimar
what
o
we've
para
been
identificar,
doing
de
to
hecho,
estimate or
las
identify
muertes que
the
no han sido
fatalities
incorporadas de
that
inicio
haven't had
con los
been
distintos procesos de
added up
búsqueda que
from
ya hemos
start with
comentado
the
y
different
que iremos
search
explicando. Tan
processes
pronto
that
tenemos
we've talked
resultados, los
about
presentamos
before.
y después una
As
síntesis
soon
más
as we have
amplia
the
ya
results, we
la
present them
explicaremos
as we've
conforme
explained
surja
before, and
todo el
later
final
on we
del
can do
proceso.
a
Pero en
summary
tiempo
that's
real
broader.
lo presento.
In real time, I'll
Me parece un
present
poco
this.
desafortunado. Hoy tuvimos
I think that it's
varios periódicos de
pretty
circulación
unfortunate.
nacional
Today we had
destacando en sus primeras planas
a lot of national
el día de la mayor
newspapers who on their
número
front
de
pages
muertes,
had that this was the
1092
day
muertes,
with
Yo
the
sé que no
higher
todos los
fatality
diarios de
rate.
circulación
I
nacional
know that not all of
ven esta conferencia
national
o mandan a alguien a ver su conferencia.
newspapers send
Algunas
someone
sí y
here to
están
see this press
habitualmente aquí
conference.
presentes.
Some of them
Les
do,
pido por favor hablen con sus
and some of them are
editores,
here.
editoras.
So I
Explíquenles que
would
esta es la
ask you to
conferencia
speak to
vespertina
your
en donde
editors and explain
diariamente
that
damos
this is the
información sobre COVID,
press conference where
la
we
pandemia
usually give
causada
out
por el nuevo
information
coronavirus SARS-CoV-2, aquí en Palacio
from
Nacional
COVID
de
for
México, en la Ciudad de
the
México.
new pandemic,
Entonces sería
SARS-CoV,
mucho
and
más
here in
contributivo
National
si
Palace in
estas
Mexico
primeras
City.
planas
It would be
ayudaran a
way
la
more
nación
productive
a
if these
ubicar
front
dónde
pages
está,
would help
en vez de causar
the
un
country
sobresalto con
to
una información que
inform them on where we
nuevamente
are
no está
instead of
técnicamente
causing
justificada.
this
Pero aquí lo presentamos
shock, which
con la
is not
esperanza de que
necessarily
haya interés
justified.
en la información
So we
técnica
present this
de la
hoping that there is
pandemia de
some
COVID en
interest in
México
the
y que esto
technical
sea lo que
information
oriente
about
la
this pandemic
información,
in Mexico, and
obviamente
that this
con
is
el
the
cariz, tono
information
y
that would
orientación
guide
que libremente cada medio
the
quiera presentar.
population, of course, with
Aquí
whatever
tenemos,
each
igual que ayer,
news
es la
media
misma
wants
gráfica,
to,
solo que con la
or
actualización del
however
4
they
de
want
junio.
to give out this
El
information. We
resumen,
can see
el
here
número
June
posible
4th,
de muertes que pueden registrarse.
in a summary,
Vean
the
ustedes
recorded
que aquí
fatalities
debajo del
that could be
350
presented here.
es donde
Below
está el punto
350
máximo de
here,
mortalidad. Si
this is the
quisieran
maximum point of fatality.
presentar este dato,
If
es
they would want to
poco debajo,
show
debe ser
this information,
340,
it's
y
maybe
esto
around
ocurrió
340.
el pasado 17 de mayo. El
And
día
this
de
happened
máxima mortalidad
May
hasta el
17th.
momento fue el 17
So
de mayo, con
the date with most
340
fatalities
defunciones
so far has
ocurridas en
been May
esa fecha.
17th. 340 deaths happened on that date. So we have the date here, starting with March 18. We have a death here, which was the earliest one. And then we have the rest. We still have an increasing pattern here that matches what we were expecting with an epidemic like this. And the ones that were identified today, these all add up to 816, and this is how they are spread. Today, June 4th, we have around 3, and then the previous dates, and this is the sum. These are the 816 fatalities. In the next slide, we can see how these 817 deaths have spread per institution, per health institution. We can see in green how 542 happened at the Mexican Social Security Institute. Red one is the color for health ministries, which are all of the highly specialized hospitals, and the other 83 are the other hospitals from that sector. We can see how from April 27th, or these two from April 29 or April 38 were confirmed today. So going on with this explanation that we would gladly give out about the deaths and when they happened, how they are identified, how they are spread. But let's not forget that we are talking about numbers here because we want to show statistically how this epidemic looks like. But each of these numbers is a person who lost their lives. It's an empty space in a family. It's a project that wasn't finished. Let's please not forget that. So going back to Dr. López Ridaura to talk about the subject of dengue, malaria, and COVID. Good night, Dr. López-Gatell. Let's quickly talk about this. Dr. López-Gatell mentioned a very important subject, which is, this is a subject that is pretty relevant right now. The rain season is beginning. As you all know, malaria is a disease that has to do with mosquitoes and with the rain season. We're going to talk about some issues that we've worked on, not just from this program, directed from Senapreset, but also from the epidemiological situation of dengue from the last few weeks, or what we've had since the beginning of this month, or what the health promotion institutes have been working on, and what the actions would have to be done that are relevant at this time.
¿De dónde venimos? Ya el año pasado fue un problema importante de dengue y lo que explicamos durante muchas
Since last year we had a very important issue with dengue.
Estos episodios cíclicos,
We've talked about how this is a cyclic process. We have years with a lot of epidemical burden. Last year was pretty high year in the epidemiological burden for this disease, and we are maybe expecting something similar this year. This is usually a cycle. What's important is that this disease, dengue, is transmitted through a mosquito. So whatever these insects are breeding, these have to do with marginalized areas of cities where there are lack of water resources, but also about health and sanitization issues, the issues about water pools where these animals are breeding. So this also has to do, of course, with the inequality of the population. As Dr. Lopez Gatell mentioned, dengue is in most of the cases have spontaneous solutions, but there are cases where that can be pretty serious. So the risk communication about this disease is very important. So this is an event where two of the presentations, and since one of the symptoms is pretty similar to COVID, and that's the fever, everyone in the health sector would have to be ready to expect that this is the disease that could be shown here. So we would have to do a clinical exercise as well to be ready. But this is not just something that doctors or medical staff would have to be ready for. Also, the population would have to be ready and know the symptoms so that they can be prepared for this risk. To be able to control these kinds of diseases, we would have to have an interaction between state and federal governments. And I would like to take this moment to thank the health ministry and all of the work that has been going on throughout these health contingency and the safe distances campaign, because they haven't forgotten about this very important aspect. So these are some of the actions that we are coordinating together with Dr. Ricardo Cortés and Dr. Alumia. Health promotion and community participation to eliminate these breeding pools, basic cleaning and sanitization in public places. To control the vectors, we'd have to do with what the program has been doing, these systems to kill these insects and to control both the larvae and the adults of these species. Also, the epidemiological vigilance, and also to stop sprouts in very different, similar regions of certain places. Also, the risk communication also strengthening the clinical abilities for all of these staff. That's not just them, but it's very important to reinforce the clinical abilities for the hospitals so that they can be treated accordingly. I'm going to go to the epidemiological scene first. This first slide, if we can see the last 10 years here and the height of these bars, these are the notified cases. A very important part here are patients who haven't had their samples taken. Both for COVID and many other diseases, we have these samples that we can use to identify an outbreak so that we can identify and treat accordingly. We have many patients here who may have dengue, but have not been yet confirmed. In the next slide, we can see the confirmed cases, though. In this slide is more evident that as of today, we have 3,200 confirmed cases for dengue, and the difference between the red color and the dark green here have to do on whether they are serious cases of dengue. The green ones are the ones that are not serious. We can see here that 2019 was a very important year for this epidemic, but also 2012 and 2013. Next slide. Maybe not as important today, but we also do an estimate on the cases. These are the estimate cases, and through these samples we can see the initial estimate, which is
es una evolución más o
19,000
menos también de la
cases.
gravedad,
Here
del
we can
índice
see
de
also the
gravedad, que estamos
evolution
viendo razón de graves
for the
contra
seriousness
no
of
graves,
these
y aunque ahora
cases.
en estos casos tenemos un índice de gravedad que ha sido más
Right now
alto,
we
esto es
have a
habitual en las
higher
primeras semanas o en los primeros
serious
momentos en donde en general hay un sobreregistro de casos
cases,
graves y después esto se va balanceando, entonces este punto 80 que tenemos no
and we
necesariamente
can
es el que se
see
va a
how they
mantener
are
durante toda la
balancing out.
temporada. En los
It's
pies de abajo vemos la
0.80 doesn't mean
circulación
that it's
viral y
going
lo que
to
podemos
keep
ver
at
es que hasta el
for the
momento
rest of the
tenemos una
season.
circulación viral mucho o predominante del dengue,
We can also
de
see
uno de
how
los
there is
subtipos
a very
del virus
important
del dengue,
spread
que
of
es el tipo
this
2. La siguiente, vamos a
virus on
pasar,
type
la
2.
siguiente y la siguiente que es importante aquí solamente
Next up
señalar que
in
hasta el
this
día de hoy
slide, we
tenemos
can
11
see
muertes
how
confirmadas.
that today we
Todavía hay
have
muertes
just
en estudio
11
para su
fatalities that are
confirmación,
confirmed,
que al
and we
igual como se ha comentado en
still
los
have
casos de
some
COVID,
that
pues
are
requiere
to
un
be
estudio
confirmed.
específico para adjudicar una muerte
This
que en
because
efecto sea
they
una
need a
muerte por
specific
dengue.
testing
Y
to
lo que quiero
prove that
mostrar en
this
estas
was a death
gráficas solamente es
caused
este canal
by
epidémico en donde
dengue.
ustedes pueden ver
We can also
cómo ha
see
sido
how
la
this
evolución del
epidemic
dengue en
channel,
lo que va del año en
how the
comparación con
evolution
lo
of
que ha
dengue
pasado en los
has
últimos 10 años,
happened
que es este canal que
throughout
se
this
marca en
year
azul,
in
en donde
comparison
la
to
línea en
the
medio es la
previous 10
mediana y
years.
los otros son los puntos percentilares 25 y
We can see
75
the
y nos
low
marcan
rate, the
más o
high
menos cuál es lo
rate, and the
esperado
media
en
here,
los últimos 10 años de acuerdo al promedio. Y
the
como pueden
average.
ver, tanto en los casos confirmados como en los casos
And
probables,
as you can
vamos,
see, both
vamos a ver que
in
al principio de las
confirmed and
semanas de este
probable
año se
cases, we
encontraron
can see
varios
that at the
estados
beginning of
en un
this year,
periodo
we had in
interepidémico,
several
o sea, ya en
states
zonas donde habíamos pasado
in
de una
an
epidemia o de una
interepidemic
temporada de lluvias, pero que
situation
se
where
alargó
the
mucho
rain
y
season was
tuvimos muchos
already
casos en
over,
enero,
but
especialmente en regiones
there
como en
we still
Veracruz o
had
en
some
Tabasco. Y
rain
esto
is
cuando lo
in states
comparamos,
like
pues
Veracruz
podemos
or
ver que sí, en
Tabasco.
efecto, en estas semanas antes de COVID
We can see how in
teníamos
these
unos brotes
weeks before
importantes que estaban,
COVID,
pero que han
we
ido
have some
bajando y lo que
important
estamos esperando
outbreaks
que en las
and
próximas
how they
semanas
have
suban.
been
Y esto lo vemos tanto en
decreasing,
los
but we
probables,
are
la
expecting them
siguiente,
to increase
como
in the
en los
following
confirmados,
weeks.
como en los estimados.
We can
La
see that
siguiente
this
y la
both in
siguiente.
the estimated
Ahora
and the
vamos a pasar
confirmed ones.
a hablar sobre las acciones, si me pasas la
Now we
siguiente.
are going to
Bueno,
start
una cosa que
talking
quiero
about
señalar, mucho se ha dicho
the
si estos,
actions
si un
that we are
problema como
taking.
una pandemia
We've
como la
talked
que
about
tenemos de
this
COVID, qué tanto impacta en la vigilancia
considering that
epidemiológica,
we
¿no?
are in a
Digo, porque si
situation of
todo
a
el mundo está
pandemic
pensando en
and
COVID, igual hay menos muestreo, hay menos búsqueda.
how this
Y
could
como pueden ver,
affect
esto
it,
nada más
because
es la
we
misma
may
curva
not be
epidémica que
able to do
señalábamos,
as much
son
of
las
the
18
testing as we
semanas que
would
están
like to in a
registradas
situation
y
like this.
las barras
We can
rosas es
see
la
the 2
positividad de
weeks
las muestras y el otro es el porcentaje
of
de
the
muestreo. Y
registered
como pueden ver, aunque hubo
tests
un
and
descenso en
also
algún
the
momento,
percentage
hemos
for the
mantenido un
testing.
porcentaje de
And
muestreo
although we
similar o
had a
similar a lo que se
decrease
ha
here,
hecho en los años previos. La
it's
siguiente.
been pretty similar to what has
Y
happened in
los
the
estados
previous
ahorita que
years.
explican el 61% de todos los casos
The
que tenemos
states
ahora
here
son
that would explain the
Veracruz, Tabasco,
61%,
Guerrero, Tamaulipas y Nayarit.
Veracruz,
Y aunque
Tabasco,
como les dije,
Guerrero,
Tamaulipas, Tabasco
Nayarit, and
especialmente y
Tamaulipas.
Veracruz
And as
tuvieron
I
muchos casos en
mentioned,
las primeras semanas y se
Veracruz,
atendieron
Tabasco,
como
and Guerrero
brotes y se
had
controlaron.
important
Ahorita digamos que todos
cases, but
estamos
that were
en
controlled.
el canal epidémico o por debajo de lo esperado. La siguiente.
But now we are below what was
Voy a ir
expected in
rápidamente ahora
this
en las
epidemic.
acciones. Una de las acciones importantes, si me pasas la siguiente, es la parte de promoción. Entonces, la Dirección General de Promoción de la
Now I'm
Salud
going to talk about
generó
the
este boletín. Es
actions
un boletín
for
dirigido a la población general, donde tiene una
health
forma
promotion.
amigable, accesible, pues la explicación
This
de
is a
una
pretty
serie de
accessible
acciones que se deben hacer y
information
se
in
deben
a
seguir
flyer that
haciendo
was given
en
out to
las
the
casas,
population,
principalmente en la eliminación de criaderos. Hubo
mainly
todo un
having to
interés, si me
do with
pasas la
the
siguiente, de
eliminating
aprovechar la jornada de
these
sana distancia para tener pues,
breeding pools
descacharrización en los
so
hogares,
that we can get rid of the
limpiar
debris,
baldes, tapar baldes y todas las acciones que normalmente se han
covering these
reforzado para la control
still
vectorial
water
intradomiciliar. Pues
places
este
and
boletín que
in
está
the different
dedicado durante la
homes.
jornada de distancia fue muy
This is
insistente
the
en tener
flyer that
en
was
fortalecer estas
given out,
acciones
and that
dentro
was very
de
important
las
to
casas.
strengthen these actions
Principalmente
inside
la
people's homes.
siguiente, porque dentro de las acciones que hace el programa, parte
Inside of
son
the actions that the
control
program
larvario
has
dentro
been
de los
taken
hogares
into
y esto
account
durante
is
la
the
sana
larvae
distancia no
control.
se realizó. ¿Me pasas
And this
la
because of
siguiente, por
the
favor?
health distancing
Entonces,
campaign
lo que
hasn't
se hizo por
happened
parte del
as
programa que
much. So
dirigimos ya
what
en
the
Sena
program
13
did
es un boletín, es un lineamiento de la estrategia de control durante
was
la
a statement
pandemia de COVID, donde
on
se
how they are
fueron
going to work
ayudando a los diferentes
in the
programas
COVID
estatales a
pandemic
cuáles son estas
regarding
acciones que
this.
se deben reforzar. La siguiente, por favor. Principalmente de las acciones de programas hay 4 tipos de acciones. Uno que es
and also supporting the state programs on which are the actions that we need to take.
Eliminar larvas en
We have 4
criaderos,
types of
rociado
actions.
residual, que es también domiciliar, y después hay nebulización
The
interna,
larvae
nebulización
control.
que son más en las vías públicas. Y como pueden ver en las barras
And we have
azules y las
spraying
grises, que
and
son las de
thermal
mayor
spraying
impacto,
in
porque
public
son las
areas.
de a nivel
As you can see in the
domiciliar, y por eso
blue
son
and
estas
gray bars
cantidades.
are the ones that have the
Podemos
highest
ver que
impact
tanto
because
el
those are
control
happening
larvario, que
in
son las barras
homes.
azules, como las nebulizaciones, pues sí
So
se
we can see
disminuyeron.
control
Mucho del
of
control
larva, which is the
larvario que
blue
se hace en
bars
casas, pues
from
durante la jornada
spraying,
de sana
did
distancia
go
no se
down.
podía hacer. Entonces se
So
reforzó
a
con el
lot of the larva
boletín
control being
dirigido a la
done in
población
homes
general.
could not be done
La
in other
siguiente,
spaces.
tenemos
So
una
this
existencia de
was
insecticidas.
achieved
Los
through a
estados han
flyer
estado
sent out
comprando
to the
insecticidas.
population.
Teníamos también, se hizo una compra adicional a final del año pasado.
The states have been buying
Y
insecticides
no pretendo que
and
vean
have
la
been
tabla
doing
estatal,
additional
pero lo
spraying
que
at the
quiero
end of
decir es
last year.
que en total tenemos,
I'm sure you can't
no lo
see
podemos
this
hablar de
table,
kilos, cada
but
tipo de insecticida.
basically it's saying that in
Pero tenemos
total,
un equivalente a
I'm not talking about
287
kilos
millones
because
de
each type of
pesos de
insecticide has a
insecticidas, de
different amount,
diferentes tipos de
but we have
insecticidas
the
que los
equivalent of
estados que han ido comprando, los estados más los remanentes
280,000
del año pasado. Y lo vamos a reforzar con la compra
kilos or
federal.
pesos of
Estamos
insecticides
la
being
siguiente con
purchased among
192
all the different
millones
states.
pesos adicionales de compra que hacemos en el Senaprece y que
We have
distribuimos en los estados,
192
y que esperamos,
million
pues ya
additional
está listo,
pesos
estamos esperando
for
que tengamos
distribution
fecha,
of
ya sea la próxima
insecticides.
semana o máximo en 2 semanas del Comité de
And now
Adquisiciones de
we're
la Secretaría
hoping
de
that we
Salud
would
para
have
lograr
some
esta
figures
compra.
next
La
week or at
siguiente,
most
y
in the
de las
next 2
últimas
weeks from
acciones
the
que se
Ministry
han
of Health
realizado,
to be
bueno,
able to
también
carry
es
out this
importante,
program.
los programas estatales han estado apoyando
In the
muchas de
last
las acciones
actions that
dirigidas
we
o
developed,
enfocadas en COVID en los
the
estados, y también
states
es
have been
importante, y desde
supporting a
aquí
lot
mi
of the actions that
agradecimiento a
have
todos
been
los programas
intended
estatales que han
or
sido
directed at
solidarios
COVID
con las acciones
actions,
generales
of
de
course.
las secretarías de salud. Y
All
el
state
última
programs have been
acción
working
que quería
together
señalar
with
es un
the
curso
Federal
de
Ministry of
capacitación.
Health.
También agradezco a la
But the
OPS que
last
nos
action
ayudó
that I
mucho
wanted to
a
point
tener
out
un
was a
curso con
training
expertos
course.
internacionales en la
So I
siguiente,
thank you to the
donde pudimos
OPS
establecer una
that
red
helped us give this course with some
estatal de
participation from
colaboradores
international
clínicos
participants.
para poder
And we were
escalar
able to
una parte de
create a
capacitación que llegue
statewide
al primer
network
nivel de
of
atención a todos los médicos y
clinical
médicos y
associates
personal de salud
to
del
provide
primer nivel de
training
atención
at the
para
first
reforzar
level
los
to all
componentes de atención
doctors,
médica, donde
nurses,
además
and
tenemos un
frontline
elemento
medical
clave
staff to
sobre la
reinforce
atención
those
y
components.
diferenciación clínica entre
So where
pacientes
we
que
have a
tengan dengue
key
o COVID y su
factor in
diferenciación.
the
Entonces,
clinical
es con
differences
las acciones que
between
hemos estado haciendo,
patients who
y
have
con
dengue
esto termino
fever
y
or
quedo abierto a
COVID
cualquier
and
pregunta que
make
quieran
that
agregar.
distinction.
Gracias.
So that's the
Muchas
end of
gracias,
my
doctor
presentation,
Ruiz
but
López
I'm
Ridaura.
open to any questions that you might have. Thank you.
Quisimos traer esta presentación del doctor López
Thank you,
Ridaura,
Dr. Rui
como iremos
Lopez.
trayendo otras para que no se nos olvide que
I
la
wanted
salud
to
es un
follow on
fenómeno
that
integral y
presentation
por lo tanto la respuesta a la
just so
salud
that
y
we
a la
don't
salud
forget
pública
that health
debe
is
ser integral.
comprehensive.
Todo está presente al mismo
So
tiempo, a
a
veces
public
se
health
exacerban unas
response has to be
condiciones, a veces se
comprehensive as well.
exacerban otras.
Everything's happening at the
Tenemos
same
la
time.
grave epidemia de enfermedades
Sometimes
crónicas, obesidad,
certain
diabetes,
conditions can
hipertensión,
exacerbate
de las
conditions
cuales el doctor Ruiz López
elsewhere,
Ridaura es un experto y
such as
también
chronic
vendrá en otro
illness,
momento a hablar de
obesity,
ello.
and some of
Tenemos
the
enfermedades
other
agudas, la epidemia de COVID,
diseases that Dr.
dengue.
Hui mentioned.
Entonces tenemos que trabajarlo todo
As we know,
simultáneamente.
of course,
Vamos a abrir a
COVID
preguntas y
and dengue
respuestas.
fever, we
Empecemos
have to
con
work on
usted que
all of
quedó
these
pendiente
at the
ayer.
same
Usted,
time.
Bianca Aguirre,
We'll open it
Alejandro,
up to Q&A, and I'm going to
Araceli
start
Anday,
with
que
you
también
because we
quedó con
forgot about you
pendientes.
yesterday. You didn't get a chance. And then Blanca
Daniela
Aguirre,
Pastrana, del último
Alejandra,
y usted también. Y Nuria Fernández.
and then Daniela Pastrana.
Buenas noches, Juan Carlos Machado, reportero. Si pudiera comentarnos ahora sí que muy concretamente
Thank
por este
you.
cambio climático que vivimos y el lluvias
Can you tell us in
torrenciales,
concrete terms,
una sequía muy prolongada en el
with the
norte,
climate change that
el
we're
dengue en
seeing,
sí
torrential
en México va a golpear
rains?
de mayor fuerza, no sé si también por esta cuestión de
So are we going to
sanitización que ha
see
tenido el país,
dengue
esto
fever
también
hitting
puede ayudar a
harder
que
in
se
Mexico
mitigue la
because
presencia
of
de esta
the
enfermedad que, como
sanitation
usted ha
issues
dicho,
in the
pues es,
country?
pues, digamos, parte de lo normal con lo que se tiene
Or
que
what can we
vivir.
do to
O sea,
mitigate
¿cómo
the
sería
presence of
este
this
año
disease?
con esta cuestión atípica
As you
que
said, it's
ha
part of what we
impactado
have
en
to
todos
live
rubros
with.
y que bueno, pues el COVID impacta también en ahora sí que
And
en
because
las
things are
otras
so
enfermedades?
not typical
Gracias.
this year, and
Muchas
we
gracias. Yo
have
digo unas palabras nada más.
impacts that we never
Desafortunadamente, no,
foresaw,
la
how do you see
sanitización que
that
se
working
hace
out?
hacia COVID no tiene un impacto significativo para la prevención de dengue.
COVID sanitation or sanitization has nothing to do with dengue fever prevention. So dengue fever comes about because we have breeding grounds for mosquitoes, and those breeding grounds are created by standing water, puddles of water, pools of water that are generally around homes or in public spaces. So I'm not talking about rivers and lakes, but I'm talking about small little pools of water. So a lot of water that might be standing or left behind in holes or potholes. Anywhere where there's a small little pooling bit of water can create breeding grounds for mosquitoes. So I just want to reaffirm what Dr. Lopez-Gattel said, that the spraying that has been done to control adult mosquitoes, it is an insecticide, and a specific one, but the component that is needed to eliminate breeding grounds both in homes and public spaces is crucial to control mosquitoes, and it has nothing to do with the sanitation that's been done for COVID. In talking about COVID-19, it's a different mechanism of transmission. It's a respiratory infection. For example, if a person coughs, they transmit it to somebody who is healthy. But dengue fever is not transmitted from person to person. You need a vector, and that vector specifically is a mosquito. So the mosquito feeds, then feeds on a sick person, takes their blood, and bites a healthy person, and then 7 days later, the virus that they got from the sick person is in their saliva, and then they transmit it to that healthy person. So obviously, this mechanism that we have is to prevent the disease. Both diseases are both quite different. So, and that's one of the things that makes the difference between the two diseases.
Muy buenas noches. Rápidamente, Juan Hernández del periódico Basta y de Grupo Cantón.
Good evening. I'm Juan Hernandez. Today we had a meeting with the congressmen and we talked about their main concerns. But you emphasized that a lot of these scientific references that you mentioned and some of that are of journalistic interest, which are the ones that are of the most important information? Yes, today at noon, I did have a session and a conversation with the House of Representatives. In that meeting, we had the participation as well as representatives from the various states and from the House of Representatives, as well as other parliamentary divisions. I thought it was good. I thought it was productive as always. Many of them had statements that were sometimes critical, but we always welcome them. We're always open that because it's open to that. It's a way to help us see the problems and the elements that we need to work on. In some cases, there was greater interest in specific issues, and other times they had concerned about areas such as the economy or politics. The themes are recurring: testing, masks, the new normal, social distancing, etc. So now what I'm commenting to you here and what I've said before on other occasions, and it's because it really impacts me, talking about these challenges going towards the new normal. So it's very easy to come up with ideas that seem to be true based on evidence, but they are not. Yesterday, Saturnino Reyes asked a question, and we talked about this. So if all this information that we're giving, if it's not properly documented as evidence, then it becomes disinformation. Then that disinformation spreads just like dengue or COVID, and this time the vectors is the media or social media. So basically, they create ideas as if it was scientific information, and specifically one of those was the diagnostic testing. As I mentioned yesterday, we had a session to discuss diagnostic measures. And many of the techniques that we're seeing is the same that we've been seeing for a while, and it's based on scientific evidence. The diagnostic testing, doing these generalized mass testing, there is no technical or scientific basis for that. There's a usefulness to conducting testing, but it needs to be done rationally with key information in order for the test results, whether they're positive or negative, result in public health decisions. That's what makes sense. So talking about the myth of like Korea had 20,000 tests and that's why they controlled the virus, I don't know. There was mention also of Peru. Initially, they detected 80,000 cases in Peru. And with all due respect to the Republic of Peru and its government, I'm not criticizing the decisions of any government, but I'm just talking about documented information. So they had 800,000 confirmed cases, diagnosed cases. And out of those, 100,000 were done using the PCR test, which is the gold standard for testing. The rest of them, 700,000, were diagnosed with quick tests. And it's also been well documented that those quick tests have a very specific use, and the probability of testing and detecting positive cases of only 30 to 50%. So that means that these diagnoses mean something different, not better or worse, but just different, such as in Korea, than a country that would use only PCR for its testing. So when we see this out in the public, whether it's in the media, in formal communication media, because this is a recurring issue that keeps coming up, or if it's on social media, these ideas get talked about. So people aren't saying, oh, we shouldn't listen to the WHO, we should be doing mass testing. So I do believe that it's important that as a society and with the assistance of such professional media and communicators as yourselves, we must ensure that the information that we're transmitting is information and nothing else. So Blanca Aguirre, then Alejandro, then Araceli, and Daniela Pastrana. Question cannot be heard. Thank you. Good evening. I wanted to ask about the case of Giovanni, a 30-year-old man from Jalisco. On May the 4th, he was arrested for not wearing a face mask. Unfortunately, after this arrest, his body was delivered to his family, and there were protests today in Jalisco. And Guillermo, in one of his tweets, said that it's murder, that it was abuse of authority and total craziness, and says that it was murder in the name of public health. What's your opinion on this case? You told us about the virtual appearance that you had with the Congress members. And so I was really impacted by this number that you mentioned, that the epidemic cycle could end up with 30 up to 35,000 deaths. And then next, I wanted to ask you if there's, if we're seeing so much mobility in the streets, if we might see a second wave and another national safe distancing period.
Gracias, Bianca.
Thank you very much, Bianca.
Sobre el primer tema,
About your first question,
expresamos nuestra
we would like to express our
a la familia de
condolences to
Giovanni
the
López.
family of Giovanni Lopez.
Definitivamente es un caso muy
It's an
lamentable,
extremely
es una
unfortunate
pérdida de
case.
una vida
It's the
humana,
loss of
y
a
eso
human
siempre,
life,
siempre debe
and that
movernos
must always
emocionalmente,
moves
racionalmente a la
us
reflexión
emotionally.
y a entender por
And
qué
we
se
need to
dan estas
understand
cosas.
why these things
Entonces, es una
happen.
pena
It's
y
a
lamentamos mucho la
shame, and
pérdida de
we
Giovanni
really,
López
really
en este
regret the
sentido.
loss of Giovanni.
Sobre las circunstancias que llevaron a este lamentable
The
deceso,
circumstances that
no
led to
quisiera
his
emitir
unfortunate
opinión alguna, dado
death,
que estoy seguro estará sujeto a una
I'm not going to
investigación
give much of an
interna
opinion on it because I
con
know
la
that there's going to be a very
corporación
thorough internal
policial que
investigation by the
corresponda
appropriate
y
police
seguramente se
authorities,
designarán responsabilidades
and they
conforme a
will be
derecho.
assigning
Entonces, si opinamos,
responsibility
es por algo.
accordingly.
Ahora, respecto al tema de
Now,
salud,
with respect to the health issue,
como hemos comentado aquí en
as
varias
we've said here
ocasiones,
before many
es
times,
precisamente por eso
that
que
is
una
precisely why
y otra vez, cuando surgía el
once,
comentario, la
time
pregunta,
after
la
time
inquietud o
after
la
time,
propuesta,
that I get the
ya
question
sea
or the
aquí en la
concern, whether
sesión
that's here
informativa
in
o
these
las
briefings
distintos
or
mecanismos
through
por los que la
other
sociedad se expresa.
mechanisms through
La
which people
idea de
express
que no van a
themselves,
usar la fuerza, que no van a
is
obligar a la
that
gente que se
saying
quede en su
you
casa,
can't use
que no
force? Are
van
they
a
going to use force? Are
ejercer
they going to force
el uso
people
de
to
la
stay
fuerza
home?
pública.
Are they going to
La
use
respuesta consistentemente ha sido no,
public forces to do
no.
that? My answer is
Porque si
no.
uno militariza
Because if
o
you militarize
convierte a la acción de la salud
or
pública
take
en un
public
asunto de
health
fuerza
action
y no de
as a
convencimiento,
forceful
no de
action and not
persuasión,
one of
y no de
persuasion,
trabajo de
convincing,
promoción de la
of
salud,
work, and of health
en
promotion,
primera es un
then first of all,
desperdicio,
it's a waste.
porque quiere decir que estamos despreciando las
Because that
capacidades
means that we're
analíticas de la sociedad
undermining or
y
not
la capacidad
valuing
de
the
la
public's
ciudadanía,
analytical
del pueblo, de las
capacities.
personas de
We're not
tomar decisiones
respecting their
saludables,
ability to
protegerse a sí mismos
make healthy
y
decisions and
además
protect
ejercer
themselves.
la solidaridad con
And
la
of course,
colectividad, como
their
de manera ejemplar
solidarity
lo ha hecho el
with
pueblo
their
de México.
communities
Y lo
and with
segundo,
all of
que también lo
Mexico.
hemos comentado,
And
nosotros muy consciente y
we
calculadamente
have been very
decidimos
aware, and we
que
made a
las
calculated
personas no
decision
fueran
to ensure
quienes fueran
that the
sujetos
people would
del acto de
not be
autoridad,
subject
que
to
las
acts of
disposiciones
authority,
de seguridad
that the
sanitaria no
health
fueran dirigidas a la
measures
persona,
that we were
sino a sus
enforcing would not
contextos.
be
Lo hemos
directed against
comentado, ¿por qué
individuals,
sale la
but
gente a
at
la
the
calle? Para
context.
trabajar,
Why are people
para
going
ir a la
out?
escuela o
Because they
llevar a
have
los
to
hijos a la
go to
escuela,
work, or
o
they
para
have to get their
recrearse
kids from
en todos los
school,
ámbitos de la
or
recreación, el desarrollo
because
cultural,
they are
intelectual,
enjoying some
social,
recreational
etc.
activities or social
Las medidas de
activities.
seguridad
So the
sanitaria
health
establecidas por
safety
el gobierno de
measures that have
México
been
van dirigidas a
implemented by
estos
the government of
elementos,
Mexico
no a las
are
personas que utilizan
directed at
estos
those
elementos,
bases and not
precisamente
specifically
porque
at those
identificamos
individuals.
que en una sociedad que ha sido ya por
And that's
muchos años
because we've
víctima
seen that the
de abusos,
society,
por
people have
violación de los
been
derechos
victims
humanos,
of
de
abuses,
impunidad,
of
una
impunity,
lenta
of
procuración e
slow
impartición de justicia,
bureaucracy, and slow achievement of
que todavía vive
justice,
un fuerte nivel
and
de
that where
violencia.
we've seen high levels of
Si
violence.
imponíamos un mecanismo de
If
coerción
we
y de uso de la
make
fuerza,
this
empezarían a ocurrir
coercive
este
and
tipo de
use
eventos
force,
muy
then we're going to
lamentables.
see these types
Entonces, no
of
se puede invocar
unfortunate
que esto es
acts
por
which you just
una
mentioned.
disposición
We
sanitaria,
can't
por
do
daño
that with a health
injustificable.
measure.
Les recuerdo que en el acuerdo del
So
secretario
if
de
you
Salud,
recall,
publicado
with
el
the
31 de
Minister of
de
Health's
este año, donde se estableció la
agreement
Jornada
in
Nacional de
which we
Sana Distancia,
established the National
agregamos
Safe Distancing Campaign,
intencionalmente la fracción
we
octava en el
specifically
artículo
mentioned
primero,
the 8th
que dice
section in
explícitamente
the first
que todas
chapter
las
that
medidas
all
deberán
measures had to
ejecutarse
be executed
respetando
and carried out
estrictamente los derechos humanos y las
strictly in
libertades
compliance and
civiles
in
consagradas por la
observance of
Constitución.
human
Entonces,
and
nadie podría
constitutional
invocar
rights.
justificadamente
So
que este tipo
nobody
de
could use
acciones
that as
las hacen en pro de
justification to
la salud.
carry out these kinds of
Ese es
action.
nuestro
So
comentario
that's
respecto
our
al caso de
comment with
Giovanni
respect to
López.
that issue.
30 o 30,000 personas que podrían
So what
perder
about the
la
30
vida,
or
lo
35
volvemos
people
a
who
comentar.
might lose their lives because of
Creo que
this?
30 o
So
35,000.
between 30 and
Y ya por
35,000. Yeah.
la segunda semana de febrero,
In the second week of
hicimos una
February,
primera
we made an
estimación
initial
de la
estimate
carga
of
esperada
the
de enfermedad.
expected
Esta
disease
estimación la
burden.
hicimos atendiendo a
And
la
we
información
calculated this
disponible en el
based on the
mundo.
information
En
we
ese
had at the
momento la
time.
epidemia estaba concentrada en Wuhan,
Most of the cases were at that time focused and concentrated in Wuhan, China, and then some cases in Western Europe and the United States. So our estimates were based on what was going on in Wuhan, China. So we decided to use that because that was the information that we had available. And we did something what we thought was relatively simple, not so complicated, and not what we would do now with scientific and mathematical information. So we took the population of Mexico and we assigned certain possible scenarios and assigned a percentage of cases that were happening at that time in Wuhan. So we're talking about the incidence rate, the percentage of people seeking health services, the percentage of people requiring hospitalization, and those who did not, and then lastly, those who had a serious illness and those who died. So in making that estimate, we considered a range of incidence of these attack rates. So at that time, it was 0.5 in Kuwait. And so then we estimated that, no more, no less. So 0.5, 0.1, 0.2, 0.5, 0.05, 0.1, 0.2, and then up to 2. So within that range, we calculated a series of numbers that we heard about before when we were talking about the hospital scaling and the level of supplies. The minimum was 6,000, another was 8,000, another scenario was 12,500, which we presented on the 17th of February at a press conference at the Ministry of Health. And then we had up to 28,000, which is around 30,000. And then in the most catastrophic scenario, up as much as 60,000. So what's the real figure? The answer is that they could all be real in different conditions. When you make an estimate, and I know that a lot of times in the public opinion, there's always a desire to want to find that crystal ball and see what's going to happen and have almost some divine knowledge, but it doesn't work like that. It's a scientific and technical resource to take an interval of plausible scenarios that depend on certain conditions. So it's the famous if and only if. And it depends on the conditions that we see, then we would have a given consequence. We're not discarding the possibility of 30,000 or 35,000, as I commented to the representatives of Congress. That is a plausible interval of what we might see. Initially, no, we plan that as the initial recourse. We planned that the governors and heads of state and the 30 governors would have a certain amount of responsibility and that they would use their authority positively to achieve social distancing. We hope that they would scrupulously carry out and make decisions to not open up business and social activities that were not appropriate at the time unless their stoplight had gone to yellow and green eventually. Alejandro, and then if we have time, Araceli. We always leave you to the last, so next time you get to start. Thank you. Within the history of the